Our bodies were created to be amazing machines, perfectly capable of taking care of way more than we give them credit for. But let's face it, we're not always good managers. We let ourselves get dehydrated, we don't fill ourselves with the right foods, we don't exercise enough, we don't stretch enough, we don't sleep enough. Sometimes life just gets the best of us, and then what happens is we end up getting stressed. And if there's one place that stress shows up in our body, well, it's in our muscle tissue. So today, I'm going to talk about trigger points, also known as muscle knots. Trigger points are defined as hyperirritable nodules that have pain when pressed on. Don't worry, I'm not going to go neck deep into the science of it all. I'm not going to talk about the little but mighty sarcomeres or the BFF molecules actin and myosin. Today I'm going to cover the areas that trigger points are usually found that contribute to headaches, stiff neck, upper back pain, lower back pain, and sciatic pain. The body has amazing ways of sending the brain signals to let it know that there is an injury. It has built-in systems to deal with things like injury, stress, and illness. Trigger points cause pain, weakness, constriction in muscle tissue, constriction in circulation, and a loss of flexibility. And there's so many different elements that cause these. Overloading muscle, overworking muscle, if you have joint dysfunction, stress absolutely is a huge contributor to trigger points. And even simple things like being chilled, those can cause trigger points as well. The most common way of dealing with trigger points is by applying pressure. And when you apply direct pressure to those trigger points, what happens is you deplete that area of oxygen. It's called hypoxia. When we release pressure, there is going to be a rush of fresh blood to that spot to try to bring all the nutrients it needs to heal that area of injury. Concerning the pressure that we apply to get rid of these trigger points, it is way less about submission and more about bringing attention to this area so that we can bring healing. So in a minute, when I show you guys how to do this on yourself, I want you to remember one very important thing. You want to be able to breathe while applying pressure. You just want to have enough to where you feel that pain, it's definitely drawing attention, and you're able to tolerate it for say up to 30 seconds. There's lots of tools out there that you can purchase to help get rid of these trigger points, but you really don't have to spend a lot of money at all, nor do you have to go far. If you can find a gumball machine that has those oversized bounce balls, those are really good for getting into small areas. Of course, there's the tennis ball. Those always work really well. One of my favorites though is probably a lacrosse ball, just because it's a lot more dense and can get a lot of pressure into some deeper and bigger muscles like the glutes and sometimes in places in the back. Trigger points are a huge contributor to headaches. So if you suffer with headaches and migraines, you can definitely check out my headache and migraine video. This is a great addition to what I talk about in that video as well. We're just gonna keep it really simple. Just go ahead and find those places where you feel like you might have a trigger point. Now sometimes the trigger point, the pain is right there, it's very local. And then sometimes when you press on it, it will refer pain to other areas. If either one of these things are happening, it's a good place to start. Just apply direct pressure and you're gonna hold that pressure, a pressure that you can tolerate, for about 30 seconds. Hopefully you'll feel that pain start to melt away during that 30 seconds, but if not, take a break afterwards and then go back and do it another 30 seconds. realize that some of the places are pretty hard to reach, especially in between the shoulder blades and the back, which is a huge area for trigger points, you can always lay on the ground. You can lean up against the wall, but sometimes that can be hard to keep the ball in place. So I took a bottom of a t-shirt and just cut it off. Or if you have a scarf that you don't need, you can use that too. Just put the ball inside and tie a knot around it. If you're trying to hit that spot in between the shoulder blades, you can go ahead and take this and just bring it around to the back, finding that spot. Lean against the wall, lean against your chair, hold it for 30 seconds and then release. And then if you have to hold it for another 30 seconds, you can do that until you start to feel it go away. Always, I hope that this video helps you guys out while you're at home. If you have any questions, feel free to comment, and you can share this with anyone that might need it. Thanks you guys for watching.